Hi, we're going to go over isolation protocol today. This is Brody. He's a 6-month-old golden retriever that came into our clinic with a 3-day history of vomiting and diarrhea. His mucous membranes are kind of light pink. His CRT is delayed. His mentation is, as you can see, a little bit dull. His temperature was 104.3. We've talked it over with the owners and we're going to perform a parvo test. Okay, we've just come back and we've run the IDEXX snap test for parvo, and Brody has come back positive. Now that Brody has come back positive, one of our employees will come and take Brody and get him set up for isolation while I clean the room with a 132 dilution with bleach with a 10-minute contact time. Wherever Brody has been in the hospital, we have to do that dilution to make sure that we kill the virus.
So now that we have a patient who's parvo positive, we're going to move them into the isolation room. I'm going to go over some of our protocol before we do that. I'm already dressed in my PPE before going into the room. We also have a foot bath out here with the 1 to 32 dilution bleach in there. That's for us to wash our feet going in and out of the room, so we're not taking anything into the room to reinfect the patient with anything or bringing the parvo back out to infect other patients. We also have written up here that Bodhi is our patient with parvo, and we listed the PPE that we need to have before going into the room. So let's go on in. I have my assistant here helping me with Bodhi. It's nice to have 2 sets of hands. Before we even come in here, we want to make sure that everything is fully stocked, that we have PPE available for people to wear, and that everything that we need is in here. We have extra gowns, blood tubes, syringes, extra flush, catheter supplies. And the other thing that's important to have is separate scrub and clippers for the isolation itself, as well as a thermometer and stethoscope. So now we're going to place the catheter in Bodhi. We're going to clip the area first, place the catheter, and then tape it in so that it's secure. And as our patient starts to feel better, we'll make sure that there's covering on that catheter so it doesn't get pulled out.
Okay, so now we've got Bodhi's catheter placed, and we've put him inside a kennel. Sierra is attending, got his fluids hooked up. We have separate fluid pump that stays in ISO, so we don't want to be moving supplies back and forth. With our fluid bags, whatever we bring in from treatment, we'll use. If we don't end up using it, we will throw this away. Again, sometimes hospital stays can be 5 to 7 days, so make sure you have your supplies well stocked. Over here we have a treatment sheet. If you're going to use your treatment sheet inside the ISO room, it needs to stay in here. So whoever's been designated needs to fill out the information here. Your other option is to fill out your information outside and keep this treatment sheet outside, and once you know your dosages, you can go ahead and fill that out either before or after. So again, we have separate supplies. We have potty pads if the dog is still going through a lot of diarrhea. And if the dog cannot eat, if it's still vomiting a lot, and we don't want to do oral food, we can place a nasoesophageal tube to provide some nutrition if it's not eating within 24 hours. Nutrition is very important to a parvo dog. If once we have done tube feeding and we've taken off, the dog can eat on its own, we do have our separate dishes and we have our separate food, so we don't have to go outside. This stays in here, they get washed in here, and they get put away in here. And if the owner does want to come visit, they can visit, but again, they would have to wear the clothing just like us. They're going to gown up, they're going to wear gloves, they're going to wear shoe covers. If they bring anything, a toy or something for the dog, it stays in here, it doesn't go back out with the owner.
So now we finished everything that we need to in ISO. I'm going to come out and get ready to do things out in the treatment area while Lee is finishing up in here. So first of all, we want to make sure that we put all of our things in the trash can in here: gloves, booties, masks. And we also have separate laundry for our gowns, which I'll take off in just a moment, but we also want to make sure that we dip our feet in this foot bath before coming back out into the treatment area.
Okay, so Bodie's gone. Everything's good. He's recovered. Now comes the task of cleaning an ISO room. So, we are going to take anything we used, dishes, get cleaned in here. I'm going to take whatever Bodie used. We're going to do a separate laundry. This goes in the sink. I have cleaning supplies down below to clean anything I need to. So I'm going to put my laundry in one bag. I've got my garbage all set right here. This is all separate. And I can take my towel from my exam table, so that will all go in. And I'm going to first use my disinfectant because we want to clean any organic material out. Fluid bags, any left over, get thrown out. Wipe down your fluid pump. Anything on the outside is going to get cleaned. I'm going to spray all in here, and I'm actually going to clean each cage because we want to make sure there's no chance for the next patient to contract anything. So along with my kennels, I'm going to spray down the outside of my cabinets. I am going to scrub out my sink, and I'm going to spray the whole outside, all the exteriors, and wipe those down. I've got my paper towel, I've got extra garbage bags, so I can clean all of these surfaces. Now once I disinfect, I'm going to take my bleach solution and start with that. You need a good 10-minute contact time to kill parvo. So what you can do is spray everything down with the bleach mixture, and it's ideal to have it in a spray bottle, and let that sit for the 10 minutes, and then come back in, do a whole nother spray down, and wipe everything down. Once you have all of your laundry, if it's super soiled, go ahead and throw it away. Once you have that, and your garbage, and you clean the floor as well, of course. Obviously separate. Here at my clinic, we have a separate mop and bucket just for isolation. And those are clearly marked, so you don't want to get those mixed up. Sierra is going to meet me at the door. I am going to take all of my personal protection off. I can discard that in my garbage bag that I have. And take the gowns that we both used and put those in the laundry bag. So my stuff's going to go in here. And then I'm going to tie my bags up. Sierra's going to meet me at the door with, let's say I took these off too. Well, yeah.
So Bodie's gone home now. We informed the owners that Pyro can be shut up to 2 weeks after being sent home, so they're aware to keep Bodie more isolated at home as well, so we're not seeing any other patients come in also infected from Bodie having parvo. We've cleaned the area top to bottom with the bleach solution. We let it have the proper contact time, let everything sit, and then wiped it down so that it is ready for the next patient to come in. We've also restocked everything and discarded any leftover fluids that we used, so we're ready for the next patient that needs to use the isolation room.